In this video, we're going to uncover everything you need to know to stop cataracts from affecting your vision. Have you ever wondered if your daily habits are putting you at risk for cataracts? Or how to spot the early warning signs before it's too late? Stick around, because we're going to dive into symptoms, treatment options, and crucial prevention tips that can protect your eyesight for years to come. Cataracts are one of those conditions that creep up on you without much warning, and often, people don't even know they have them until their vision starts getting cloudy. Essentially, a cataract forms when the clear lens of your eye becomes cloudy, making it harder to see. Imagine looking through a foggy window or trying to read a book through a smudged glass. It's frustrating, right? The lens, normally clear, becomes clouded over time due to age or other factors, causing blurry vision and sensitivity to light. Now, this process doesn't happen overnight. It's a gradual buildup, and that's what makes it tricky. By the time someone notices something's off, cataracts might have already started developing. So, if you're over 40 and noticing subtle changes in your sight, don't brush it off. More than 24 million people in the US alone over the age of 40 are affected by cataracts. But here's the kicker. Most of them don't even realize it. It's a condition that slowly progresses, and it's easy to attribute symptoms to aging or just being tired. Ever felt like you needed to wipe your glasses when they're already clean? Or maybe you've had trouble driving at night, with lights from cars glaring in your eyes more than they used to? These could be early warning signs of cataracts. The problem is that too many people ignore these subtle changes, thinking they'll go away on their own. By the time they realize it's serious, cataracts have already taken a toll on their vision. But here's where things get interesting. Cataracts aren't just a problem for the elderly. Sure, they're more common as you age, but other factors like smoking, diabetes, and even prolonged exposure to UV light can speed up their development. This makes it all the more important to understand what cataracts are and how they can be prevented. So, now that you've got a clearer picture of what cataracts are, you're probably wondering how to recognize them before they start affecting your daily life. Let's get into that next. Topic 1. Recognizing the symptoms. One of the most challenging aspects of cataracts is how easily the symptoms can be mistaken for something else. You might start experiencing blurry vision, but it's easy to chalk that up to needing new glasses or having a long day at the computer. But when that blurriness doesn't go away, or worse, it starts to affect your ability to see at night, that's when you should really pay attention. Cataracts can make light seem too bright, creating halos around them that are especially noticeable when driving at night. You might also notice increased sensitivity to light in general, where stepping outside on a sunny day feels blinding, even with sunglasses on. These early signs can seem small at first, but they shouldn't be ignored. Now, imagine this. You're sitting in a dimly lit room and trying to read. You might think the lighting is bad, but no matter how much you adjust the light, the words still seem out of focus. This is a classic sign of cataracts. As the condition progresses, you might even start to see double or find it harder to distinguish colors. Everything starts to look faded or yellowed. This can sneak up on you gradually, making it harder to notice right away. And the truth is, by the time these symptoms become disruptive, cataracts have already started to form in your eye's lens. That's why it's essential to catch these early symptoms before they lead to serious vision loss. Recognizing cataract symptoms early is the key to taking action before the condition worsens. So, are you experiencing any of these symptoms right now? If so, don't wait to act. But what can you do about it? Whether you're already noticing changes or simply want to stay ahead of the game, knowing the treatment options available is your next step. Let's explore how cataracts can be managed and, in many cases, treated effectively. Topic 2. Treatment options for cataracts. When it comes to treating cataracts, the earlier you address them, the more options you have. In the early stages, cataracts might not interfere with your day-to-day life much, and simple solutions like stronger lighting or a new prescription for your glasses can help you manage. But, of course, these are temporary fixes. If your cataracts are mild, these adjustments can make a world of difference, allowing you to continue your routine without too much disruption. However, as cataracts progress, these fixes won't be enough. That's when you'll need to consider more definitive treatments. The question is, how long can you manage before it becomes necessary to move to something more serious? As cataracts advance and your vision becomes more impaired, cataract surgery is the most effective treatment. In fact, it's one of the most common and successful surgeries performed worldwide. During the procedure, the cloudy lens is removed and replaced with a clear, artificial lens, restoring your vision to what it once was. The beauty of cataract surgery is that it's not only safe but also incredibly efficient. Most people recover within just a few weeks and see immediate improvements in their eyesight. So, if you've been living with blurry vision or sensitivity to light, this surgery could give you your life back. And the best part? The success rate is over 95%, so you can feel confident that this solution works. But here's the big question. Is surgery the only option? What if you could avoid reaching that point altogether? While cataract surgery is a reliable fix, wouldn't it be better to prevent cataracts from worsening in the first place? The good news is that there are ways to slow down their progression and even prevent them from developing. So, if you're not ready to consider surgery just yet, or you simply want to avoid it down the road, it's time to focus on prevention. Let's dive into the best ways to keep your eyes healthy and prevent cataracts from taking hold. Topic 3. Proven cataract prevention tips. Prevention is always better than cure, especially when it comes to cataracts. One of the easiest and most effective ways to prevent cataracts is by simply wearing sunglasses with UV protection. UV rays from the sun can cause long-term damage to the lenses of your eyes, speeding up the formation of cataracts. This is true even on cloudy days when those harmful rays are still sneaking through. A good pair of sunglasses that block both UVA and UVB rays can make all the difference. And while you're at it, consider wearing a wide-brimmed hat when you're out in the sun for extra protection. A small shift in your daily routine can have a huge impact on your eye health down the road. Now, let's talk about smoking. If you're still lighting up, your eyes are paying the price. Smoking significantly increases the risk of developing cataracts because it introduces harmful toxins that damage the lens of your eye. Think of it this way: every cigarette is like taking a puff on your clear vision. The good news is that quitting smoking not only lowers your risk of cataracts, but it also helps your overall health in so many ways. If quitting feels like a tall order, think of your eyesight as extra motivation. Each cigarette you skip is a win for your vision. And if you're not a smoker, great. Stay that way, and your eyes will thank you. Diet is another powerful tool in your cataract prevention toolkit. Foods rich in antioxidants, think leafy greens like spinach, kale, and broccoli, help to protect the lens from damage caused by free radicals. Carrots, with their high levels of beta-carotene, are great for your eyes too, just like your parents always said. But it's not just veggies. Citrus fruits packed with vitamin C can also keep your eyes in top shape. These nutrients work together to slow down the oxidation process that leads to cataract development. So, the next time you're grocery shopping, load up on these eye-healthy foods. A diet full of antioxidants is like giving your eyes a natural shield against cataracts. And here's a quick but important tip: stay hydrated. Keeping your body properly hydrated can also help protect your eyes. Dehydration can cause your eyes to become dry and more susceptible to irritation, which can indirectly affect their overall health. Drinking enough water helps maintain the natural balance of fluids in your eyes, ensuring they function optimally. And while you're focusing on fluids, it's a good idea to cut back on alcohol, too. Excessive alcohol consumption can speed up cataract formation, so moderation is key. Pairing these small lifestyle changes with regular eye checkups can help keep cataracts at bay. But what if prevention isn't enough? Let's explore what happens when cataracts do start developing and how to live with them. Topic 4. Living with cataracts and next steps. Living with cataracts can be frustrating, but it doesn't mean you're out of options. If you suspect you have cataracts, the first thing you should do is schedule an eye exam. Regular checkups are crucial because they allow your eye care professional to track the progression of cataracts and suggest the right time for treatment. It's not something to ignore, as cataracts worsen over time, leading to significant vision loss. So, if you've noticed blurry vision, increased sensitivity to light, or other cataract symptoms, don't wait until your daily life is disrupted. Early detection can make all the difference in maintaining your quality of life. If you reach the point where cataract surgery is recommended, know that it's one of the most effective and safest surgeries available. The procedure involves replacing the clouded lens with a clear artificial one, and the recovery is usually quick. Most patients are back to their routine in a few days. Imagine regaining clear vision after struggling with blurry eyesight for months or even years. The success rate for cataract surgery is over 95%, so the odds are heavily in your favor. It's a straightforward way to reclaim your vision and, in many cases, your independence. But if you can prevent it from getting to that point, why not try? For those not ready for surgery or whose cataracts aren't severe yet, there are still ways to manage the condition. Improving lighting around your home, updating your eyeglasses prescription, and using magnifying lenses for close-up work can all help in the short term. However, these are temporary fixes, and cataracts will continue to progress. That's why it's essential to stay proactive and explore your options. The sooner you act, the better your chances of preserving your vision long-term. Now, let's circle back. What can you do today to prevent cataracts from developing in the first place or slow down their progression? Now that you know how to recognize the symptoms of cataracts, the available treatment options, and the key prevention tips, it's time to take action. What changes will you make today to protect your vision? Maybe it's scheduling that overdue eye exam or adjusting your daily habits to prevent cataracts from developing in the first place. Remember, your eyesight is invaluable, and these small steps can make a big impact. If you found this information helpful, be sure to give this video a like, share it with someone who could benefit, and subscribe to the channel for more health tips. Don't forget to hit the notification bell so you never miss out on new content. And before you go, check out the next video on the screen, where we'll dive deeper into other important ways to protect your overall eye health.